So Frances is an open access journal of high-class quality, shared with, I think, more than 100 countries worldwide. And our transplantation group for ALL, Acute Lymphoblastic Leukemia, and the whole topic on the value of allogeneic stem cell transplantation was invited to work on a research topic. And we invited not only colleagues from the scientific community contributing to our forum trial, but also from outside the study, and 105 authors contributed to this research topic, dealing with all important questions on the difficult issue of transplantation of bone marrow and blood stem cells. So the forum trial is the most successful pediatric trial for the transplantation of acute lymphoblastic leukemia nowadays, where we asked the very difficult question whether we need irradiation in children. And we demonstrated that after 40 years, total body irradiation is more efficient compared to chemoconditioning. So that means that the backside of the coin, the side effects of irradiation, are still important to cure very aggressive acute lymphoblastic leukemia. And after this publication in the most relevant scientific journal, which is called Journal of Clinical Oncology, was the reason why Frances invited us to work on a complete research topic. Stem cell transplantation is the most successful immune therapy for curing patients with leukemia. And although this approach is very successful and established, we have a lot of problems to deal with. For instance, we have to find a donor. And we now know that besides sibling donors, unrelated donors, but also parents are important stem cell donors to have a transplantation in time. Then the question, who should undergo a transplantation, is another very important topic, because the long-lasting side effects should qualify only patients who have no sufficient chance to be cured by, let's say, milder chemotherapy options.
First, it is important to clearly define which patient should undergo allogeneic stem cell transplantation, and it could be shown in the forum study that the total body irradiation is the best myeloablative conditioning. Second, the procedures of stem cell transplantation, like the techniques of conditioning and the various procedures of GvHD prophylaxis and treatment, are of importance. Also of importance is the supportive care and the anti-infectious prophylaxis and the treatment of infectious complications. It is clear so far that for patients with a non-high-risk leukemia, so for patients with a low risk to experience a relapse of their leukemia, allogeneic stem cell transplantation is not the main indication.
And then, of course, we have the topic of side effects of the transplantation, which includes organ toxicity, but also effects of infections and complications when donor cells attack the patient, and of course the long-term complications in children who undergo a transplantation. That, for instance, include fertility issues, but also complications included with growth retardation and tissue damage, and for instance the question of thyroid dysfunction and lung problems. So all these side effects were reviewed by our experts and described not only with current results but also reflected by what is already written in the past.
The lifelong consequences of stem cell transplantation comprise a variety of complications and sometimes long-term sequelae. The main cause of long-term morbidity after transplantation is the occurrence of acute and later chronic graft versus host disease. Chronic GVHD is the main cause for long-term morbidity and mortality after stem cell transplantation. Therefore, this is a major focus of our clinical research. In this initiative, we developed a holistic view of pediatric GVHD, its diagnostic tools and its treatment. On the basis of an individualized risk profiles and site-specific GVHD assessments, including demographic and clinical data, we developed a personalized management plan for pediatric GVHD. This also included the development of a treatment algorithm.
One of the most burning questions for me is, do we really need transplantation in the era of other immunotherapies? For instance, CAR T cells might be substituting allogeneic stem cell transplantation, but also, for instance, antibodies which attack leukemic cells are an option to get rid of allogeneic stem cell transplantation, and that is highlighted by three important reviews by our co-authors.
I think future studies are needed to really answer this question properly, but in the meanwhile, allogeneic stem cell transplantation with TBI conditioning for high-risk leukemic patients is still an indication.
I think the topic on new methods of total body irradiations had the most views. In total, we had more than 54,000 readers who already read our papers. And the issue on total body irradiation from Bianca Höben from the Netherlands is those with the most views. So it seems to be an urgent question whether we could improve the technique of total body irradiation to have less side effects.
So luckily, within the last 10 to 15 years, a lot of efforts have been made to develop better prophylactic procedures and to decrease the acute toxic side effects of allogeneic stem cell transplantation. We currently have a variety of new antibody treatment regarding acute and chronic GVHD. So I would say within the last 5 to 10 years, we made a great step forward.